A 17-point drop in systolic blood pressure in 4 weeks from a supplement most people have never considered for blood pressure. That is not a claim from a supplement company. That is from a clinical trial published in a peer-reviewed journal. And that is just one of 3 supplements we are covering today. And none of them are what you would expect. No garlic, no fish oil, no magnesium. These 3 fly completely under the radar, and the research behind them is more serious than most people realize. Let me introduce you to the first one. It is called hibiscus, and if you have ever had a red herbal tea, there is a good chance you have already consumed it without knowing it had anything to do with blood pressure. Here is what the research found. A randomized controlled trial tested a standardized hibiscus extract against lisinopril, an actual prescription blood pressure medication, in 171 patients with hypertension. After just 4 weeks, hibiscus reduced systolic blood pressure by over 17 points and diastolic by nearly 12 points. The prescription drug did perform slightly better, but the tolerability of hibiscus was 100% compared to 98.81% for lisinopril. No serious adverse effects were reported. Let that sink in. A flower extract, head-to-head with a prescription drug, in a peer-reviewed clinical trial. For dosage, if you are taking it as a supplement, look for 250 to 500 milligrams taken 2 to 3 times daily. If you prefer tea, steep about 1 gram of dried hibiscus calyx once in the morning or twice daily with 8 hours between doses. Do not exceed these amounts unnecessarily. And that is just the first supplement. The second one is something most people already have sitting in their kitchen but have never once connected to blood pressure. That spice is cinnamon. While it's usually sitting in the kitchen spice rack rather than the supplement cabinet, the research suggests we should be looking at it differently. A meta-analysis of 9 randomized controlled trials covering 641 patients found that cinnamon supplementation produced a significant reduction in both systolic and diastolic blood pressure. Systolic dropped by over 6 points and diastolic by nearly 4 points. The effects were strongest at doses of 2 grams or less, and when taken consistently for at least 12 weeks. Most people sprinkling cinnamon on their oatmeal are not getting anywhere near a therapeutic dose. This is about supplementation, consistent, measured, daily intake. However, most grocery store cinnamon is the cassia variety, which contains coumarin, a compound that can stress the liver in high daily doses. For a consistent 2-gram habit, look for Ceylon cinnamon, often labeled true cinnamon. It provides the same blood pressure benefits without the coumarin risk. For dosage, the research points to 2 grams per day or less as the sweet spot for blood pressure. You can split this into 2 1-gram doses daily. Just keep in mind that the precise effective dose is still being studied, so staying at or below 2 grams is the safest and most evidence-backed approach. Next up is a plant with a serious identity crisis, lemon balm. No, it has nothing to do with lemons. It is a herb from the mint family that researchers have recently started taking seriously for cardiovascular health. A meta-analysis of randomized controlled trials found that lemon balm produced a statistically significant reduction in systolic blood pressure, consistent and reliable enough across multiple studies that researchers confirmed. It was not happening by chance. The studies used doses ranging from 1,000 to 3,000 milligrams per day over 6 to 12 weeks, with higher doses showing stronger effects. The evidence is not as deep as hibiscus, yet only 3 trials measured blood pressure specifically. But for something this under the radar, what is already there is worth paying attention to. 3 supplements, hibiscus, cinnamon, and lemon balm. None of them are what most people think of when they hear blood pressure. All 3 backed by clinical research. And all 3 available without a prescription. If you want to try any of them, I have linked the best options on Amazon in the description below, already filtered for quality and dosage. If this video gave you something new to think about, the like button is right there, and subscribing means you will not miss the next one. See you then.